I'm Toddleen Dafferlin, and here's a Sun TV News Brief. Two major Caribbean conferences are being held in the Turks and Caicos Islands from Wednesday, October 28th to Friday, October 30th. The 13th Annual Organization of Caribbean Utility Regulators Conference is being held at Beaches Resort and Spa, while the 10th Caribbean Health Financing Conference is being held at the Regent Palms Resort. 10 countries from around the Caribbean are participating in the Regulators Conference, and 27 countries from the Caribbean, South America, and North America are represented at the Health Conference. The Turks and Caicos Islands is receiving a tremendous amount of regional and international media coverage from both events. Speaking at the opening of the Health Conference, Premier of the Turks and Caicos Islands, Honorable Dr. Rufus Ewing, who is also Minister of Health, announced that his government plans to amend the NHIP law to make it easier for more persons to receive proper coverage for health care. Here's what he had to say.
The National Health Insurance Plan, even though conceived as a social health insurance plan that would have achieved universal health care coverage from day one, it excluded or did not adequately provide for two major vulnerable groups in our society. Those persons unemployed beyond 90 days and undocumented children of work permit holders. The health risk and cost burden associated with the non-coverage of these groups of individuals are far greater than the financial liability of coverage without contribution or minimal contribution. The non-coverage of these vulnerable groups of persons threatens the long-term sustainability of the National Health Insurance Plan and the finances of the government revenue, and goes contrary to the goals of the attainment of universal health coverage and universal access. It is therefore the priority of my government this year to amend the national health insurance legislation to make provision to correct these inequalities, inequities, and reduce the financial risk of health care costs to these individuals and the risk of sustainability of the National Health Insurance Plan.
Premier Ewing also revealed that the NHIP was able to cut the cost of spending on overseas medical treatment by $28 million since 2009.
The implementation of risk reduction strategies, such as qualifying period for eligibility for overseas care for migrant labor and a tiered capitation system of funding, is critical to the sustainability of the overseas treatment component of the National Health Insurance Plan, which is funded by government. The National Health Insurance Plan has managed this program extremely well, with a reduction in the cost of overseas treatment from $40 million in 2009 to currently just over $12 million, with twice the eligible population beyond the belonging population now, including the entire population registered under the National Health Insurance Plan. The provision of expanded secondary care services locally at the hospitals, combined with the purchasing of more cost-effective services locally and overseas, has also contributed to the significant reduction in cost of overseas care.
In his address to the conference, Minister of Finance Honorable Washington Mizik stated that government is working on ways to reduce costs in the healthcare sector.
We have to find ways to design our healthcare systems that take into account and align itself not only with our economies, but also align ourselves with the health profiles of the nations and islands that we represent. And that is going to call for looking at various areas. I'm not an expert in this area, but I think it's my job as Minister for Finance, and considering the fact that Turks and Caicos, while we have a health system that need a lot of improvement, we do have a health system that we're growingly proud of. It is a very expensive one, on a per capita basis or on as a part of our overall percentage of the government revenue, it's probably the highest cost element in the whole structure. But we are working on ways to reduce costs and ways to reshape the delivery of services to our community in a way that would add public value. And health, we often hear, is a human right. Human rights issue. And so in framing a health initiative, it's important that everybody is brought along. It's important that it's a cooperative effort.
Meantime, over at the Regulators Conference, Governor of the Turks and Caicos Islands, His Excellency Peter Beckingham, announced that there will be changes to allow for greater use of alternative energy.
We had a good discussion the other week with one of his directors from Canada that the TCI government and the British government, and I know the former Minister for Energy, George Lightbourne, are very passionate about alternative energy. We have our regulator here. We will be making announcements and developments in our legislation to look at changes to allow more alternative energy within Turks and Caicos Islands. But can I take this opportunity to say, without revealing anything confidential in our discussions, Eddington, how pleased I am that you have indicated some changes already in Fortis's approach to alternative energy, which should mean that some of perhaps the major resorts, the major supermarkets can start to develop alternative energy in a way that I know from visiting Antigua and other countries, some other Caribbean countries are already pretty well advanced in, and I'm very pleased that Fortis are looking in a very positive way at this development.
Minister of Home Affairs, Transportation and Communications Honorable George Lightbourne, who delivered the feature address, noted that in Turks and Caicos Islands there is currently no legislation that deals specifically with online and social media. He said, however, that there are small sections in the Telecommunication Ordinance and the Electronic Transactions Ordinance which will apply to online and social media.
But in the absence of specific online and social media laws, employers must consider our common law and other statutes in order to determine their online and social media policy and to balance and protect the rights of both the employer and its employees. Ladies and gentlemen, perhaps the greatest challenge will be in ensuring social media control measures that encourage free speech, yet protect society from various ills. A great chunk of our lives is spent at our places of work. Employers therefore need to implement workable social media strategies and policies. There must also be enforcement mechanisms coupled with staff training, and in the best case scenario, having an online and social media manager. In this fast-changing world, employers are scrambling to protect their businesses from the theft of trade secrets, theft of client records, for clients' solicitation, and defamation. On the other hand, their employees' rights to privacy and dignity must be maintained.
Well, that's it for now from Sun TV News. Thanks so much for watching. Until next time, I'm Toddleen Dafferlin.